Hi, everyone. Welcome to Sonata Insights Live. I am Tara Murphy, Senior Director of Global Marketing and Advocacy at Gynesonics. Sonata Insights Live is a program that we've launched at Gynesonics to spark conversation about fibroids, the symptoms of fibroids, and educate women about their treatment options. During these episodes, you hear from guests including physicians, patients, as well as advocates as they share stories and educate our audience. I'm excited to have Dr. Day with us today from Atlanta. Welcome, Dr. Day.
Hi, Tara. Thanks for having me.
Let me tell the audience a little bit about you. So Dr. Day grew up in Gwinnett County and earned her engineering degree from Georgia Tech and pursued her medical doctorate from Emory University. She completed her OBGYN residency at Parkland UT Southwestern and specialized in robotics and minimally invasive pelvic surgery through a fellowship with North Texas Gynecology Oncology. With over 11 years of experience, Dr. Day now focuses on gynecological care using the Da Vinci robot and advanced minimally invasive techniques to treat fibroids, endometriosis, and heavy menstrual bleeding. She practices at the Fibroid and Pelvic Wellness Center of Georgia, combining her experience with compassionate patient-centered care. Outside of work, Dr. Day enjoys traveling with her husband and two sons, exploring new cultures, and engaging in outdoor activities in Atlanta. So welcome, welcome.
Thank you.
So we are going to talk all things fibroids today. So first off, I would love if you could just talk to our audience a little bit about what actually are fibroids.
Yeah, sure. We get this question a lot, even after people have been diagnosed, but they are smooth muscle, benign tumors, but tumors nonetheless, that grow inside of the uterus in all different locations within the uterus.
And when you have women that come into your office, what are they usually saying to you about maybe the symptoms that they have or the things that they're experiencing that may indicate that they have fibroids?
Sure. Fibroids can cause a range of symptoms. It just really depends on where the fibroids are located, right? So it can range anywhere from what people have normally heard of, which is heavy menstrual bleeding, certainly can lead to, when they're really big, can lead to bloating and constipation and pressure on my bladder, so urinating very frequently. A lot of women have significant pelvic pain during their menstrual cycle, and honestly, sometimes outside of their menstrual cycle as well. So a whole range of symptoms, really depending on how big the fibroids are and where they're located.
And when women come in and say that they may have like heavy menstrual bleeding, what would be considered to be a normal cycle, or that something that may say to you as a woman, oh, this is a little bit too much of bleeding?
Yeah, and that's a good question, because people will eventually get referred to us and they're like, oh, I thought all that was normal, or my primary care said that was fine, or my mom said, you're a woman, it's okay, that's normal, and so I think it is important to kind of chat about what is normal and what's not normal. A lot of women, when they're using up these big diapers every day, they're using those big long pads and they're changing them every single hour, when they have big chunks of tissue and clots come out, when they're anemic and constantly being told, oh, you need to take more iron, that sort of thing, all of that is not normal.
And how long should a cycle last as far as days go? Is there an average number of days?
No more than 7 days. When it starts to get longer than that, I certainly get concerned. Yeah, but everyone's a little bit different. Some people's cycles are 2-3 days, and but I think we're looking for a change, right? Like, okay, I used to have cycles that were 2 or 3 days, and then maybe I used 4 pads a day, and now they're 7 or 8 days, and I'm using 8 pads a day. Well, that's a big difference. So we're looking for a change.
That's a good piece of advice. If something has differed from your normal, that's probably a time to go and see you for a consultation. That makes sense. So when you say you have these symptoms, you go in and we talk to you and you have a consultation. How are you actually diagnosed with fibroids? How do you find out if
Yeah.
has them?
Our practice is a little unique because people come to us already diagnosed for the most part and looking for treatment options. But in general, We'll do a physical exam. Certainly, if they're large enough, we can feel an irregular uterus on your annual or your physical exam, especially if you're complaining about some irregular bleeding or whatnot. But we have ultrasound in our office, and we utilize that quite frequently. So we can, in real time, diagnose fibroids with a transvaginal ultrasound, sometimes a transabdominal one. We use MRI quite a bit in our practice as well, because, again, location is so important as to where these fibroids are, and it gives us a good idea of what treatment options will work for a patient, which ones are a better idea, which ones are not going to work very well.
So depending on what type of fibroid you have will determine what your treatment options may be.
Yeah, and like what type of fibroid you have, but also what are your goals at this moment, right? Are we interested in future fertility? Is your goal just to get rid of the bleeding altogether? Is your goal like, well, I'm very busy. I have an active life. I can't take all these time off or take all this time off for surgery. What can you do for me? So sure, where they are, but also what are we doing? What's going on, in your life?
Yeah, I think that we talk a lot on here when we do our Insights Live about um, how important it is to find a physician that hears you and wants to talk to you about your goals. Could you talk a little bit about just what advice you would give to women out there if they're going to some physicians and maybe they're just not necessarily hearing them, they're listening to their symptoms, but not hearing them about as far as what their journey they would like it to be?
Yeah, I think, I would answer this in a long way, but I would say back when I was in residency 10 something years ago, we were kind of told, well, if it's, a little bit bothersome and yes, they have some fibroids, leave it alone, don't do anything, right? So I think a lot of physicians now are at a point with their patients where they're like, well, yeah, your bleeding's a little heavier, but let's just leave it since you want a baby at some time in the future, or it's not that big of a deal. And patients are going, well, yeah, but I'm bleeding a whole lot. What do we need to do about this? And they're like, well, we'll look at it next year, or we'll ultrasound it again next year. And really no changes are happening. No medicines being offered, no surgical options are, kind of being discussed and thrown about. And I think it's easy enough nowadays, especially with telehealth, if you are really like, hey, I really want to talk about what options I can do, because there are preventative options. It used to be back in the day, it was, well, do you want a hysterectomy? Do you want these fibroids removed and cut out with a long recovery time? And now we have a few more options. And I think it's fair to say, okay, well, let's get a second opinion by somebody who is gynecologic only, somebody who does minimally invasive surgery, somebody who's willing to and has an armamentarium of things to be able to offer.
Because I think a lot of times we hear from women that they're either told, let's watch and wait, or to the other extreme of hysterectomy. So
Correct.
I would love if you were able to talk a little bit about what the treatment options are that are available kind of in between that least and most invasive, so that women
Yeah.
understand kind of what that looks like.
Yeah, I mean, it's been very exciting in women's health and especially in fibroid health in these last couple of years because, again, even 10 years ago, it was, well, do you want me to do your hysterectomy, or here's some medicines we can kind of throw at you? And certainly there's some benefit to both of those, but not everybody wants either of those. And now we have, additional options of robot that wasn't around that long ago. We have additional options of radiofrequency ablation with Sonata specifically, where we can ablate fibroids and have minimal downtime, and it's incisionless, and we can do something kind of in a preventative world, which we were not able to do before, right? In addition, of course, medications and whatnot.
So when patients get medication, for example, we hear a lot of times when we're doing our patient education events that they maybe are put on a birth control. And a lot of times women think that because their symptoms have stopped or decreased a
Correct.
lot, that their fibroids actually aren't continuing to grow or that they're going
Yeah.
away. Can you talk a little bit about that to make sure that people do understand what's going on when you're put on something like a medical management?
Yeah, I mean, and I think certainly medical management can be appropriate for the right person at the right time, but you're certainly correct. I mean, we are band-aiding the symptoms when we're on medications, really, and we're hoping to to get a couple years out of it potentially. How long can we get on out of that? But your fibroids are still growing. They're fed by the estrogen that comes from your ovaries, and that, makes you a woman. So you want to have estrogen, but unfortunately, we're not doing anything to stop the growth of these fibroids with medications.
And on the flip side, something that we hear a lot is that when women are told that they need a hysterectomy, they think that they're automatically going to go into menopause.
Right.
So I'd love for you to clear that up for our.
Yeah, yeah. And I probably say this more than like 10, 15 times a day, right? It's like, well, let me present all my options to you, but hold on a second. Let me kind of, in detail tell you a little bit more before you say, no, I'm not interested. I don't want that. Happened to my sister, and she gained a bunch of weight, or whatever they may say. But when we do a hysterectomy, we're cutting the uterus out, we're cutting the cervix out, plus or minus, and those are not where hormones are made from. Your ovaries make all your hormones. They make your estrogen, they make your progesterone and testosterone. And so you really can have your uterus removed and really not go through menopause. And so I think when we clear that up, and we tend to look on the blogs and what's going out there on the universe, and we see that common misconception, like, oh, don't do this, this is going to happen to you. And it's like, you don't know what happened to your friend. You don't know if your ovaries were removed, or if she was 50 when she had her hysterectomy and she was going to go through menopause anyway, right? So, but your ovaries do all that, and you certainly can get a hysterectomy without going straight through menopause.
Thank you. And, when we talk about all of these procedures, there's a whole range, from least to most invasive, but I think a lot of times it does depend on, like you said earlier, the type and the size and the location of where your fibroids are. So it is really important to be able to find a physician like you that's talking through all of those different options and making sure that they understand that there are different types of fibroids, and not every treatment is going to be right for every type of fibroid. And so when we talk about Sonata, for example, can you talk a little bit about who that is appropriate for as a patient?
Yeah, I like Sonata. In my practice, I will tell you that it has really changed a lot of my watch and wait patients that I don't want to watch and wait for anymore, because I have this little tool that I can use. I think anybody who comes in with heavy cycles, they're going to get an ultrasound, for example, right? And we're going to be able to have a conversation about where their fibroids are. If there's fibroid in the cavity, I oftentimes want to remove the fibroid in the cavity because they cause the most bleeding, and their symptoms will drastically improve when I can get rid of that. But additionally, people will have other fibroids that are in the muscle of the uterus. So they're not all the way on the outside, they're not in the cavity, and they're just, 2, 3, 4 centimeter, multiple fibroids in the muscle. And certainly some could have the option of a myomectomy, right? Let's do a big robot surgery. We take all these fibroids out. Recovery time tends to be a few weeks, 6 weeks sometimes. And I am able to use Sonata in that situation, right? I can cut out the fibroid that's in the cavity hysteroscopically without an incision. I'm able to then use the radiofrequency ablation with the Sonata to actually target the fibroids that are within the muscle of the uterus. And then we can shrink them. We can destroy that abnormal tissue that will shrink over time. And that's kind of preventative, so that as you grow, as you age, we're not continuing to grow these, where then your only option becomes a myomectomy or a hysterectomy, a big open surgical approach, right?
And with Sonata, we do talk to women a lot about, if you have another fibroid that occurs, you can get Sonata again on those new fibroids. And there's some procedures you can't do a duplicate time.
Correct. Yeah, I think Sonata, when people come into the office, like I think what you're alluding to is maybe a uterine fibroid embolization, perhaps. And people will come to the office and they will have spoken to somebody already for UFE, and they wonder if they're a good candidate for that. Or they'll come to me for a second opinion and they say, hey, I heard this was really painful. Or, I don't know, my friend got it and it didn't really shrink her fibroids very much. And I like this as an alternative because women are really after minimally invasive approaches, right? They want to get back to work. They want to get back to their families, and they want something that's going to work. And I like the approach of Sonata because the investment in terms of time is very little, and we can do a lot with the radiofrequency ablation. So women, we do the procedure in 10, 20, 30 minutes. They go home the same day, which is great. Recovery times tends to be a weekend. If we do your surgery on Friday, most everybody Monday, Tuesday is back to normal life, with really minimal side effects. And so I think your investment in time and energy is very minimal, especially if you're going to get a significant amount of return, in terms of decreased flow and pain and whatnot.
Yeah, I love talking to women about Sonata because, too, just as being a mom and working full time and all those things, we're always putting ourselves last. So
Very
yeah, so it's really hard to take that week or 2 weeks or multiple weeks to recover when you have to, take care of a lot of people around you. So it's always really nice to be able to say to those patients like you have that are watching and waiting to say, you know what, there is something that is an incisionless treatment option that could get you back to normal activity pretty quickly. So I love that women are finally being recognized as an audience that deserves multiple treatment options.
great. Absolutely.
Whatever's right for that fibroid is going to be the right choice that you decide with your physician. And it's great to be able to have these options now rather than just one option of, a hysterectomy or suffer through it.
Yeah, and I'm really, really, I mean, one of the benefits of social media, whatever you may feel about it, and I think one of the benefits is that people are coming to the office and they're saying, hey, I heard this exists. Am I a good candidate for it? Right. And I think it just opens up the conversations. They're bringing their sisters. They're bringing their, hey, my aunt she complains about stuff every single month. Can you talk to her too about what are all of her options? It's kind of opening up that door to not scare women, right? They're like, if I go to the doctor, they're going to tell me I need a
Yeah.
hysterectomy, and I don't really want to do all that, so I'm just not going to go to the doctor. I'm just going to suffer and perhaps get, a couple ER visits and get some iron infusions and blood, blood transfusions. And I think it's like, okay, well, there are more options now. Like, it's a little less scary to come to the doctor's office because we have more options for them. So I really do like that people are coming and asking, like, what is radiofrequency ablation? Am I a good candidate for it?
Yeah, same. And I think it's just really nice because I think we all, have suffered in silence with these issues because you think it's normal or it's embarrassing. And then you realize, there's a large percentage of the population of females that are having this, and it shouldn't be a taboo conversation. And I think, using social media for topics like fibroids and heavy menstrual bleeding and even, going into menopause, I think we've seen such a shift over the past few years of women being empowered with that information and then being fortunate enough to come to a physician like you that's willing to hear it and knows about it and is educated on all of those different treatment options is just such a nice and refreshing change of pace for us for women's health, which is amazing.
No, absolutely. And again, a big change from what I was able to offer people, 10 years ago to now. So, and, I have patients that have come back and said, this has changed my life. I'm not bleeding anymore. I'm not constantly worrying about what seat I'm going to mess up at work. And if I can even go to work that day, right? I mean, we as women have so many missed days, at least the people that show up in my office, missed days from work. I'm having so much pain, I can't get to work. I have to I have to recover this day from work because I missed it because I was in so much pain. And when you hear that and you're like, how long have you been doing that? We can help you, and I like to be able to fix that pretty quickly. So.
Yes, I like that you're able to do that too. It's great. So you answered my last question, which was going to be, what are patients saying about Sonata? What are the insights that you're getting from women after that?
Yeah. Yeah. In general, we tell women that your fibroid is going to have some shrink right off the bat, right when we do the procedure, but over time it's going to shrink some more, right? Fibroids, after they've been radiofrequency ablated, they not only do they shrink some, but they also get softer, less pressure on your bladder, that sort of thing. So I'm hearing a lot of that, but really most importantly, that recovery time is super fast and that they're not bleeding like they were bleeding before. And I honestly happy that they had another option where they didn't have to take all this time off of work and had the option open for fertility in the future if they want it, right? And so yeah.
Yeah, that's awesome. Thank you for your time. You're always so
Yeah.
helpful and passionate about what you do, and we are very grateful to have you as a treating physician for Sonata and as a woman who's treating other women for fibroids as well. If you would like to make a consultation with Dr. Day, I will give her a moment to kind of share her office information.
Yeah. You're going to ask me to find a phone number, and I don't.
Oh, no, I have your.
I could find it for you really
Oh,
quickly,
no,
but that's
I
just funny. That is the one thing I should have memorized,
have
but of course
no.
I don't. Um,
We actually.
okay, so our office is called Fibroid and Pelvic Wellness Center of Georgia. Our website is pretty clear about all the different things that we can offer. And we do it all, which I think is lovely. It's in Peachtree Corners, but in Atlanta. And our office phone number is I'm reading it. I'm 678-580-1736. And of course, our website is Fibroid and Pelvic Wellness Center of Georgia. Yeah.
Yes, and you can also find Dr. Day on our physician finder on sonatatreatment.com. So that's another way to be able to find her as well. Go to sonatatreatment.com, go to the physician finder, and go to at Georgia, and she'll be listed there under her office with her office phone number and information. You can go on, fill out a consultation form, and we'll make sure that our nurse advocate gets that information to her office so that you can schedule a consultation. And if you're outside of the Georgia area, you can also go on to there and find a physician throughout the country that offers Sonata and can give you a consultation to see if that's the right procedure for you. Our next episode of Sonata Insights will be on December 10th at 3 p.m. Pacific, 6 p.m. Eastern. So please be sure to join us then. And you can always find all of our episodes up on our YouTube channel as well. And again, you can visit our locator at sonatatreatment.com to get connected with Dr. Day. And we will be happy to make sure that you can get a consultation with her or any other physician across the country. Thank you. Thank you very much, Dr. Day, for your time.
Thank you, Tara. I love always chatting with you.
You too. And everyone have a good evening. Thank you.
Good evening.
Bye. Thank you.